Physician Quality Reporting System 2013 Group Practice Reporting Option. Which reporting method is right for my group? Part 2. Program Year 2013. In Part 1 of this presentation, we discussed earning the 2013 PQRS incentive using the GPRO Web Interface or Registry, and we discussed 2013 PQRS GPRO reporting mechanism options. In Part 2, we will discuss avoiding the 2015 PQRS Payment Adjustment. We will review the 2015 Payment Adjustment, discuss ways to avoid the 2015 Payment Adjustment using the GPRO Web Interface, Registry, or Administrative Claims reporting options, and also discussed quality tiering. This presentation will cover the PQRS Group Practice Reporting option. To participate in GPRO via the Medicare Shared Savings Program, the Pioneer ACO Program, or CPC initiative, please consult the respective program requirements. Registration is available from July 15, 2013 through October 15, 2013. You must sign up to participate as a 2013 PQRS GPRO. If you self-nominated in January 2013, you can also change your reporting mechanism. Also available are the Administrative Claims reporting option and the Quality Tiering option for purposes of the Value-Based Payment Modifier. Please use the information and instructions that follow to sign up to participate as a PQRS GPRO. Go to the CMS portal at this link. On the right-hand side, select Login to CMS Secure Portal. After accepting the terms and conditions, enter your IACS user ID and password in the Welcome to CMS Enterprise Portal screen. Select Login to continue. Select the PV PQRS tab at the top of the screen, then select Registration from the drop-down menu. You will see a screen where the group practice and eligible professional that are associated with your IACS account are listed. To register a group practice for the first time, select the Register link to the right of the group practice you want to register. If your group practice is participating in the Medicare Shared Savings Program, then you will see an alert message letting you know that it is not necessary for you to register the group practice or EP in the PV PQRS registration system. Refer to the group practice registration in the PV PQRS registration system quick reference guide or the individual eligible professional registration in the PV PQRS registration system quick reference guide located on the Medicare Fee-for-Service Physician Feedback Program / Value-Based Payment Modifier website in the Downloads section of the Self-Nomination / Registration page at this link. A review of the 2015 PQRS Payment Adjustment. Section 1848A8 of the Social Security Act requires the Centers for Medicare and Medicaid Services to subject eligible professionals and group practices who do not report data on Physician Quality Reporting System quality measures for covered professional services during the 2013 program year to a payment adjustment beginning in 2015. The applicable percent for payment adjustments under PQRS are as follows: 1.5% adjustment in 2015. Eligible professionals will receive 98.5% of his or her allowed Medicare Part B physician fee schedule amount for covered professional services that would otherwise apply to such services. A 2% adjustment in 2016 and subsequent years. Eligible professionals will receive 98% of his or her allowed Medicare Part B physician fee schedule amount for covered professional services that would otherwise apply to such services. To avoid the 2015 PQRS Payment Adjustment, group practices participating in the PQRS GPRO will have to satisfactorily report data on quality measures for covered professional services provided in 2013. GPROs are analyzed at the TIN level. All providers under the TIN who bill Medicare Part B Physician Fee Schedule will be included in analysis for purposes of the 2015 PQRS Payment Adjustment. Avoiding the 2015 PQRS Payment Adjustment. Beginning in 2013, group practices of 100 or more eligible professionals may be subject to the value-based payment modifier. More information on the value modifier can be found at this link. 2013 GPRO reporting methods. There are 3 ways to report as a GPRO and avoid the PQRS payment adjustment in 2013. GPRO Web Interface, Registry, or CMS Calculated Administrative Claims. Available 2013 PQRS GPRO reporting mechanisms. If your group size is between 2 and 24 eligible professionals for the reporting period January 1 through December 31, 2013, you can use either the Registry or Administrative Claims reporting method. If your group size is between 25 and 99 eligible professionals for the reporting period January 1 through December 31, your group can use the Registry, Administrative Claims, or GPRO Web Interface reporting methods. If your group size is 100 or more eligible professionals for the reporting period January 1, 2013 through December 31, you can use the Registry, Administrative Claims, or GPRO Web Interface reporting method. The Administrative Claims reporting method can only be used for purposes of avoiding the 2015 PQRS Payment Adjustment. It cannot be used for purposes of earning the 2013 PQRS incentive. Ways to avoid the 2015 payment adjustment. Satisfactorily report for PQRS incentive eligibility as defined in the applicable 2013 measure specification. Report specific PQRS GPRO measures through the web interface based on a pre-populated patient sample. Reference the 2013 PQRS GPRO Web Interface specification, which is only available to group practices of 25 or more eligible professionals. Or report at least 3 registry measures for the PQRS GPRO. Reference the 2013 PQRS measure specification for claims/registry reporting of individual measures. This is available to all group practices participating in PQRS GPRO. Report at least 1 valid measure via the GPRO Web Interface or Registry, or select the Administrative Claims option. GPRO Web Interface. This reporting method is limited to groups of 25 or more eligible professionals. For groups of 25 through 99 eligible professionals, you must report on all measures included in the GPRO Web Interface and populate data fields for the first 218 consecutively ranked and assigned patients in the order in which they appear in the group sample, with an oversample of 327 for each disease module or patient care measure. If the pool of eligible assigned patients is less than 218, then you must report on 100% of assigned patients. For groups of 100 or more eligible professionals, you must report on all measures included in the GPRO Web Interface and populate data fields for the first 411 consecutively ranked and assigned patients in the order in which they appear in the group sample, with an oversample of 616 for each disease module or patient care measure. If the pool of eligible assigned patients is less than 411, then you must report on 100% of assigned patients. GPRO Registry Reporting. This reporting method is open to GPROs of all sizes. For registry reporting, you must report at least 3 measures and report each measure for at least 80% of the group practice's Medicare Part B fee-for-service patients seen during the reporting period to which the measure applies. CMS Calculated Administrative Claims. This reporting method is open to GPROs of all sizes. The Administrative Claims option is only for purposes of avoiding the 2015 PQRS Payment Adjustment. Groups cannot earn the 2013 incentive payment using administrative claims. To report via administrative claims, you must report Medicare Part B claims data for CMS to determine whether the group practice has performed services applicable to certain individual physician quality reporting system quality measures. Eligible professionals will not submit quality data to CMS. Eligible professionals will give CMS consent to analyze claims data directly to determine whether a clinical quality action related to a quality measure was performed. GPROs and eligible professionals must register report via administrative claims. Additional information on registration can be found in the July 31st CMS National Provider Call presentation found here. PQRS and the Value-Based Payment Modifier. Quality tiering. During the second registration period, group practices with 100 or more eligible professionals will be able to elect to have their 2015 Value-Based Payment Modifier payment based on quality tiering. Quality tiering is voluntary. Quality tiering will determine if group performance is statistically better, the same, or worse than a national mean. CMS will use the performance rates on the quality measures reported through the PQRS reporting mechanisms, for example, GPRO Web Interface, CMS Qualified Registry, or CMS Calculated Administrative Claims, and the 3 outcome measures to calculate their value modifier. This could result in a positive or negative 2015 PQRS Payment Adjustment for a relatively small number of groups with cost and quality performance indicators that vary substantially from the mean. If a group elects quality tiering but does not meet the satisfactory reporting criteria for the PQRS incentive payment, CMS will use the group's performance on the administrative claims option to calculate the value modifier. The majority of groups will have no adjustment as a result of choosing quality tiering, only the outliers. The registration period is July 15th through October 15th, 2013. New groups can register for participation in PQRS. PQRS GPROs who previously self-nominated will be able to change their reporting method selection. Groups and eligible professionals can select the administrative claims option. Groups can select the quality tiering option if applicable. Groups will need an IACS account with security official and PQRS submitter roles to access the registration system. Please see the IACS user guide for assistance at this link. Look for these other 2013 PQRS GPRO webinars on the CMS YouTube site at this link. 2013 PQRS GPRO 101, Parts 1 and 2, and 2013 GPRO Reporting Mechanisms, Part 1. Upcoming webinars. This slide shows the upcoming webinars that will be posted on the CMS YouTube link. Value-Based Payment Modifier, Publicly Reported Information, Measures, Individuals Authorized Access to the CMS Computer Services, or IACS, Clinician and Group Consumer Assessment of Healthcare Providers and Systems, or CGCAPS. We also intend to host live training sessions on GPRO reporting following the close of registration, which is scheduled for October 15th, 2013. Visit the GPRO section of the CMS PQRS website at this link for more information. You can also contact the QualityNet Help Desk at the information posted on this slide.